Hello my dear students, myself Dr. Mahesh Kumar. Today I am going to present on topic disc prolapse or prolapse intervertebral disc. As you know, the vertebral column is stack of series of bone that is known as vertebrae, and it is of five types, that is cervical vertebrae, thoracic vertebrae, lumbar vertebrae, sacral and caudal vertebrae, and their numbers are respectively cervical 7, thoracic 12, lumbar 5, sacral 1 and caudal 1. The term prolapsed intervertebral disc, disc prolapse, herniated disc and slip disc are used synonymously. Larger the prolapse, more the symptoms. It is a general rules in case of disc prolapse, and the disc prolapse mainly seen in adult 20 to 40 years of age group and have the person having this sedentary lifestyle. The commonest level in vertebral column involved are between L4 L5, that is lumbar region or lower back region, and the C5 and C6 region, that is cervical or neck region. What is intervertebral disc and what is prolapse? The disc is situated in between the adjacent vertebrae of the vertebral column. Intervertebral disc is made up of three components, that is nucleus pulposus, annulus fibrosus, cartilage in plates. The vertebrae cushioned with disc, it absorbs the shocks of daily activities like walking, lifting, and it protects the vertebrae. When the nucleus pulposus, the inner soft part of disc, bulges out to weaken the outer part of the disc, it is known as prolapse disc. Etiology of intervertebral disc prolapse, that is the heavy weight lifting, age-related wear and tear, disc degeneration, trauma, fall, blow to the back, and the risk factors like obese patients having heavy body weight cause stress on the disc side, weak muscles and sedentary lifestyles, the physically demanding job or regular weight lifting occupations, genetic factors, and in chronic smokers. Includes in this prolapse the disc has sequence of changes as nucleus degeneration, nucleus displacement, and the stage of fibrosis. The secondary changes includes the change in the structure occupying the spinal canal and the change in intervertebral joints. The stages in intervertebral disc prolapse includes the stage of degeneration, that is have no bulge, and the stage of protrusion, the intervertebral disc just have a bulge, and the stage of extrusion, that is bulge out but in contact. The stage of sequestration is bulge out and have no contact, and the last the stage of fibrosis is the repair stage. Clinical features. The clinical features depend on the location of the herniation and the types of soft tissue involved. Typical symptoms seen at one side of the body, and the symptoms ranges from no symptoms to mild pain to severe pain as per pathology. And the commonly age group are 20 to 40 years age groups, and the persons have the sedentary lifestyles. The person has history of trauma and the occupation of heavy weight lifting. Clinical features include low back ache, that is the commonest symptoms, tenderness on back muscle, individual spine process, sciatic pain nature, the pain with or without radiation, the sciatic nerve root. Neurological complaints include paresthesia, pins, needles involved dermatome, left foot numbness and muscle weakness. Pain increases during spine flexion and reduced in spine extension. Pain aggravates while coughing, sneezing, and in Valsalva maneuver may have feature of cauda equina syndrome. The cauda equina is the cauda equina syndrome. The spinal cord ends above breast region but continues through the spinal canal is a group of long nerve roots that resembles the horse tail, that is cauda equina. It had features of pain in the slip disc, pain and numbness mostly on one side of the body, pain extends to the arms or legs, worsens at night, unexplained muscle weakness, tingling, itching and burning sensations. Diagnosis of the disc prolapse is mainly clinical examination, diagnosis and history. Nerve functions, muscle weakness examinations, and the past illness, lifestyle, and obesity, occupations, etc. Radiodiagnostic investigations include CT scan, MRI, X-ray, myelography, etc. The clinical examination includes postures of the patient, movement during walking, tenderness, straight leg raising test, slump test, bowstring test, Lesibu test, neurological examination, and sciatic nerve root examination. It includes mainly radio imaging and plain X-ray. First of all, plain X-ray. Basically, a plain X-ray is advised to rule out bony pathology and infections and narrow disc space, leaking of vertebral margin, etc. in X-ray. The CT scan includes the herniated disc material can be seen in CT scan. In MRI, the MRI is the investigation of choice and it shows clearly prolapsed disc, the theca and the nerve roots of particular nerve. The electromyography or EMG, it helps in finding denervation, specific nerve root and affected disc. The myelography are used in cases where precise localization of neurological signs not possible. The differential diagnosis includes the ankylosing spondylitis, vascular insufficiency, extradural tumor, spinal tuberculosis, or generally we can say that review the all aspect of package while differentiating the prolapse discs from the other causes of package. The ankylosing spondylitis have the chronic back pain, starts in lower back, diffuse morning stiffness, chest expansion reduced, and in X-ray bamboo spine appearance, the sacroiliac joint, the haziness and fuse sign seen. In prolapse disc, the radiating pain, SLR test positive and localized nerve root deficit finds. In X-ray may be normal, MRI test may confirm the diagnosis. The vascular insufficiency is also a cause of low baggage that may be excluded while differentiating the disc prolapse. Extradural tumor have back pain accompanied by weight loss, weakness of arms, legs, nerve pinching, and paralysis in different body parts. The X-ray, CT, MRI, and biopsy used to differentiating or making the diagnosis. Spinal tuberculosis, the patient has history of tuberculosis, may be extraspinal tuberculosis, local pain, local tenderness, local stiffness, and muscle spasm seen. These are cold abscess, the gibbous and prominent spinal deformities mainly seen in spinal tuberculosis, history of tuberculosis present, and the investigations include the positive skin test, ESR raise, and biopsy, PCR test, etc. Also, in cases of back pain, the traumatic cause of back pain and secondary myeloma cause of the back pain also needs to explore it. The complication include the cauda equina syndrome, the permanent nerve damage, rarely weakness and paralysis. In few cases, bladder or bowel dysfunctions finds sudden anesthesia. The compressed nerves causes loss sensation inner thighs, the back of legs around rectum. How to manage a case of slip disc or prolapse intervertebral disc? It depends on the level of discomfort and how far disc slipped. The aim is to manage either conservatively or operatively. To achieve the remission of symptoms, conservative method is best. In non-responding cases, after 3 to 6 weeks of conservative treatment in cardiac syndrome, the operative treatment is the choice. The treatment includes the rest, reduction, and removal. The rest includes the bed rest, action for 10 kg, drugs like painkiller, non-steroid anti-inflammatory drugs, spinal corset, and reduce the activities. Reduction includes the continuous bed rest, action for 2 weeks, epidural injections of corticosteroids and local anesthesia. Removal includes indicate for disc removal like cardiac lesion, neurological deterioration, persistent pain and sign of sciatic nerve tensions, and level of prolapse is found by CT and MRI. The three methods of surgery adopted is the partial laminectomy, microdiscectomy, and percutaneous discectomy. The conservative treatment includes rest on hardware, posture correction, and drugs like painkiller, muscle relaxants, nerve pain medications like gabapentin or diloxetine. Physiotherapy by hot fomentation, gentle arching exercise, lumbar traction, and treatment includes the disc removal technique, microdiscectomy, fenestration, spinal fusion, laminotomy, hemilaminectomy, laminectomy, and the chemonucleosis percutaneous discectomy. It is operating procedure mainly indicated in failed conservative treatment plan and had cardiac syndrome, severe sciatic pain. Includes exercise, regular to make flexibility, muscle tone, back, leg, and abdominal muscles. Posture care during sitting, lying, keep back straight, aligned, sit upright, and walk erect. Avoid excess pressure at spine. Avoid weight lifting or with caution. With the help of leg, thigh, reduce pressure on disc. Healthy weight advice, treat obesity and reduce weight. It reduces pressure or stress on spine. Avoid or stop smoking. Thanks for your patience listening. Your questions and suggestions are welcome. Thank you. Thank you.